Hello everybody. So today we are going to learn about syphilis, which is one of the important topic of reproductive system. So whatever I have this is from the Apurva S. Sastry and Sandabhat uh, textbook of microbiology. So let's learn about syphilis. So syphilis, it is a sexually transmitted disease caused by Treponema pallidum. So Treponema pallidum refers to its pale staining property, and treponema means tripos means turn and nema means thread. So most of them are commensals of oral cavity and genitals, and few species are pathogenic, which can be divided into two groups. Okay, so treponema belongs to spirochetes. So what is spirochetes? So spirochetes are thin, flexible, elongated spirally coiled helical bacilli. So they include Treponema, Borrelia and Leptospira. So sexually transmitted Treponema pallidum, syphilis. Okay. Non-venereal treponematosis like Treponema pertinae, Treponema endemicum, and Treponema caratinum. So let's know about the pathogenesis of syphilis. So syphilis is one of the ancient sexually transmitted infection known since 15th century. So name was derived from famous poem in 1530 which describe a legend of shepherd boy named Syphilis who had suffered from the disease. Okay, so mode of transmission is venereal syphilis. It is acquired through sexual contact. However, it can also be transmitted by non-sexual method such as direct contact, blood transfusion, and transplacental transmission. So I am highlighted here. So Treponema pallidum rapidly penetrates through the minute abrasions of skin or mucosa, and within few hours it enters the lymphatics and blood to produce systemic infection and metastatic foci long before the appearance of primary lesions. So blood is infectious even during incubation period. So it should be very important. It is very important point, or in the early stage of syphilis. So incubation period can range from 10 to 90 days. So let's talk about clinical manifestation of syphilis. What are its clinical manifestation? About 30% person who have sexual exposure with infected partner develop syphilis. Okay, so there is clinically patient suffering from syphilis passed through 4 stages if it left untreated. Okay, primary, secondary, latent, and tertiary or late stage. Apart from this, if it is transmitted vertically, the newborn babies develop a congenital form of syphilis. So, what is primary syphilis? In primary syphilis, there will be a hard chancre. So, hard chancre, it is characterized by single painless hard indurated ulcer covered by thin exudate, okay, which is rich in spirochetes. Okay, the most common site of primary chancre is penis in case of male, and cervix or labia in case of females, and also anal canal, rectum or mouth in homosexuals. So number one is there will be chancre. Another one is there will be regional lymphadenopathy, usually inguinal lymph node, within inguinal lymph node. It appears within 1 week of onset of lesions, and lymph node are painless. Okay, point to be remembered, it is painless. Painless lymphadenopathy in case of syphilis, but painful in case of genital herpes, chancroid, lymphogranuloma venerum, and there is no lymphadenopathy in case of duodenopathy. Okay, painless chancre. So chancre generally heals in 4 to 6 weeks, but lymphadenopathy may persist for months. Point to be remembered. So, and another one of the important point, if it is acquired by non-venereal mode, then primary syphilis is presented as follows. If it is transmitted by direct contact, the primary chancre is extragenital, remember, usually on fingers. If it is transmitted by blood transfusion, the primary chancre does not occur. Yes, points to be remembered. Now let's move about secondary syphilis. Secondary syphilis is usually develops 6 to 12 weeks after the healing of primary lesions, and skin and mucous membranes are commonly affected, and it is characterized by skin rash, condyloma lata, mucous patches, okay, and generalized lymphadenopathy. Okay, skin rash commonly on palm and soles, as we can see in this picture. There are rashes, okay, multiple rashes. And condyloma lata means mucocutaneous papules, which appears in a warm, moist regions such as perianal regions, vulva, and scrotum. Another one, mucous patches, superficial mucosal erosions, generalized lymphadenopathy. The chin and chancre may persist up to 1/3 of cases. So that is secondary syphilis. And what about latent syphilis? Secondary lesions usually subside within 2 to 6 weeks, and the infections persist to latent syphilis. So in latent syphilis, there will be absence of clinical manifestation, but there will be positive serological test and normal CSF findings. So it may be early latent syphilis, which occurs within first year after infection, or late latent syphilis, which occurs after first year of infection. And patients are still infectious in latent syphilis, okay? And latent syphilis may have one of these following fate: persistent lifelong infection, development of late syphilis, or spontaneous cure. So after latent syphilis, there will be late or tertiary syphilis. So several decades after initial infection, it occurs. So in which gummatous lesions, gumma means they are locally destructive granulomatous lesions which appears in bone and skin. Okay, there will be cardiovascular lesions, neurosyphilis also. In cardiovascular lesions, clinical manifestation include chronic meningitis, vasculitis, genital paresis of insane, and TEPS dorsalis. Cardiovascular syphilis includes aneurysm of ascending aorta and aortic regurgitation. So there may be congenital syphilis, mother to fetus transmission can also be there. So this much for this video, and about next video I will be talking about laboratory diagnosis of syphilis.